The overall decrease in life expectancy has been driven by an increase in mortality among the working age group of 24 to 65-year-olds, says Stephen Wolf, who co-authored the report.
A big piece of this is an increase in deaths from drug overdoses. That has been one of the biggest drivers of the trend.
According to the Centers for Disease Control and Prevention, on average, 130 Americans died every day from an opioid overdose in 2017. However, this is not the only ill that cut American lives short.
There's been increases in death rates in that same age group for alcoholism, for suicides, for dozens of organ system diseases. And I'm referring to things like diabetes and lung disease and heart disease. That has also increased in this same age group. Altogether, we counted 35 causes of death.
John Hager of the National Institute on Aging says this is unprecedented.
Demographers have their hair on fire. This is a big deal. We haven't seen something like a decline in life expectancy in this country since the early years of the AIDS epidemic, and before that in the great years of the international flu epidemic after World War I.
But he also says the decline in life expectancy is the combination of a process that's been decades in the making.
This has been going on for a long time. The U.S. has been falling behind other countries in mortality improvements in these very direct and visible measures of health status for decades.
It's important to treat the symptoms as well as the underlying cause of health problems, says Wolf.
In addition to developing policies for drug addiction and for alcoholism and for suicides, we need to step back and ask ourselves, what is it about living conditions in America that's driving people to these behaviors? Why do they have so much pain that they're turning to painkillers? What is responsible for the desperation that's leading to suicides? Why is their diabetes so poorly controlled?
Something echoed by John Hager.
We spend about double the European average on health sector. It's a $3.5 trillion industry in the United States. No other country comes close. Where we're really falling down is in preventive care and all the things people should be doing: physical activity, a good diet, attending to health problems early.
The study was published in the Journal of the American Medical Association. Mariama Diallo, VOA News, Washington.